Okay, and we are live. Welcome to the first talk in the St. Luke's and Idaho Clinicians for Climate and Health learning series on climate change and its impacts on human health. This is our first talk for the 2025 series. We've got an outstanding spring session that's already up online on our website, so take a look at all the upcoming talks. Our next talk is on February 19th. Featuring Lori Byron from Montana, talking about her work in pediatrics and climate change, as well as supporting the youth movement to sue the state of Montana for the right to a clean environment in the future. We'll also have speakers from the city of Boise and their Youth Climate Action Council talking about what we're doing locally on that same kind of work. Today, I am really excited to introduce Dr. Philip Landrigan, who to my mind is really sort of the godfather on exploring the human health impacts of plastics. Dr. Landrigan is a pediatrician and epidemiologist, and for 5 decades, his research has examined the impacts on human health, especially children's health, of hazardous exposures in the environment. In recent years, he's expanded this research to encompass planetary scale threats to health, climate change, pollution, and biodiversity loss. From 2015 to 2018, he co-chaired the Lancet Commission on Pollution and Health, which found that pollution causes 9 million deaths per year. Since 2019, he has led the Monaco Commission on Human Health and Ocean Pollution, and is currently the chair of the Minderoo Monaco Commission on Plastics and Human Health. He works with the WHO and UN Environment Program, and has served for 41 years in the Public Health Service and Medical Corps of the US Navy, and he retired from Navy at the rank of captain. He is a member of the US National Academy of Medicine, and I am so excited to have Dr. Landrigan joining us today. Just as a reference before he starts talking, if you can please post questions in the chat, we'll collect all the questions, and then we'll have a Q&A session at the end of his discussion. So post your questions now, we'll review them at the end of the talk, and I'll turn things over to Dr. Landrigan. Thank you.
Evan, thanks very much, and it's a privilege to be here in speaking in this series on climate change and health. I'll try to connect the dots and explain why plastics and climate change are related. Just to give you a heads up, they're related on several different levels. Firstly, all plastics are made from fossil fuels, from coal, from oil, and from gas. And so at that most fundamental level, plastics are related to climate change. And then when plastics are produced, the production of plastics is a very energy intensive process. Approximately 2% of all the greenhouse gas emissions to the atmosphere globally result from plastic production. That's about as much greenhouse gas emissions per year as the entire nation of Brazil. And then plastic waste breaks down and contributes carbon to the atmosphere and further drives climate change. So the two are intimately linked on so many levels. I'm also going to do, I think it's something that you're doing throughout the seminar series, I'm going to really focus the talk on human health impacts. To be sure, I'll talk about environmental contamination, how we measure it, how much is out there, but my real focus is going to be on human health. And I'm doing that for 2 reasons. First, because I'm trained as a pediatrician, and I just think it's really important to talk about the health impacts of these global environmental threats like climate change, like pollution, but also being very pragmatic. I just don't think we're going to engage the American public. I don't think we're going to engage policymakers in the fight on climate change, in the fight against pollution, until we talk about effects on health. Because, you know, if we talk about climate change in the abstract and we're talking about molecules in the upper atmosphere, it just doesn't resonate with most people. It doesn't hit them where they live. But if you talk about impacts on their health, and even more so if you talk about impacts on their children's health, it really engages people. And I think we're much more likely to provoke action and make some progress. So excuse me, with that as a prelude, let me open up my screen sharing thing here. And Reverse the view. Good. Yeah, so here's the title, The Growing Threat of Chemical and Plastic Pollution and Its Impacts on Human Health. So I think most of you have seen some version of this picture.
Dr. Landrigan, just to interrupt real quick, we're not seeing your slideshow view. If you could just try to click that slideshow view from beginning, maybe, or start slideshow.
Hang on, excuse me.
That's okay.
Give me a minute to fiddle with it. Sorry about that. How's that now?
Still seeing the same view of kind of everything.
How are we now?
You'll get the same thing.
No, I'm gonna.
There. Yeah, just try.
Let me start again. Hang on. Oh, sorry about this.
That's okay.
Is that showing now?
Perfect.
Okay, good. So sorry about that. Yeah, so I was starting to say, you've probably all seen some version of this picture, these, and this is how plastic pollution first came to public attention. It was really the marine biologists who first recognized that visible plastics like fish nets could entangle seals, or that plastic cups and plastic bottles could obstruct the gastrointestinal tracts of marine mammals like this whale. And people see all this plastic waste washing up on beaches. And the marine biologists were really aware of plastic pollution as a problem as long ago as the 1970s and the 1980s. But I think it's really only in the past decade, and even the last 5 or 7 years, that we finally begun to understand that plastic is not just an environmental problem, even though it most certainly is an environmental problem, but it's a human health problem. And it was to explore the implications of plastics for human health that back around 2020, in the middle of COVID, we formed the Minderoo-Monaco Commission on Plastics and Human Health. The two major sponsors were the Minderoo Foundation, which is a big foundation in Australia, and the Principality of Monaco in Europe, the Scientific Center of Monaco, and hence the name of the commission. And as you can see from the logos, it was headquartered here at Boston College. The goals of the commission were, firstly, to document the full range of plastic hazards, not just to look at plastic waste, not just to look at plastics in the environment, but to document the full impacts of plastics on human health, and to do so across the entire plastic life cycle. And let me take a moment in the next couple of slides to explain what I mean by the plastic life cycle. So let's begin with talking about what is plastic. So they're complex manufactured chemical materials. As this picture of the pump jack indicates, they come 99% from coal, from oil, from gas. And basically every plastic, doesn't matter which one you're talking about, has two main components. Firstly, it has a polymer backbone, a matrix, which is basically consists of thousands of repeating elements like polyvinyl chloride or polystyrene or polyurethane, polyethylene. Those are the polymers. And then thousands of additional chemicals are mixed into the plastic to give it particular properties, to give it color, to make it flexible, to enable the plastic to resist heat and fire, resist water, resist ultraviolet. Those are the chemical additives. So here's a schematic drawing of a plastic molecule. You have the backbone, which consists of these are the carbon atoms here, the black things, and the carbon-carbon bonds that comprise the three-dimensional matrix of the plastic. And then you have all these different chemicals, phthalates, bisphenols, PFAS, brominated flame retardants, and many, many more that are popped into the polymer like this and give particular properties to the thing. And what happens during use and after the plastic is disposed into the environment is that those additives can disappear. They can leach out of the plastic and then go out into the environment. And many of those additive chemicals are very toxic. And they can comprise as much as 50% of the plastic by weight. So they're not just, it's not like a little sprinkle of salt on top of the polymer. It's actually, the additives are often a very essential component of the final product. So this is what it looked like way back in the 1950s when I was just a kid, that it was considered the bright dawn of the plastic age. And this, I don't know how many of you remember Life magazine, but it was a very prominent picture magazine back at that time, published by the people that published Time magazine. And they praised what they called throwaway living, that these disposable items could cut down on household chores. And the caption under the picture said, the objects flying in this picture would take 40 hours to clean, except no housewife need bother, because they're all meant to be thrown away after use. So back in 1955, plastic waste was not a very big problem, but today, unfortunately, it is. And the reason plastic waste is such a big problem today is that from the 1950s until the near present, plastic production has just been accelerating. It started out very slow through the 60s and 70s. And as you can see, it's accelerated, picked up speed. And we've gone from less than 2 million tons per year in 1960 to about 450 million tons per year. So it's more than a 200-fold increase. And here's up to the present. Here's the future. And as you can see, it's projected production is projected to increase still more in the decades ahead. It's going to double by 2040, which is here, and by 2060, which is over here, it's going to triple. And the biggest component of current plastic production, and also the most rapidly growing component of current production, is single-use plastic. Think about things like plastic water bottles, plastic shopping bags, plastic bag that comes with a dry cleaning, food wrapping. All of that stuff that gets used once, gets thrown away, now comprises somewhere in the neighborhood of 40% of current use plastic, and that fraction is growing year to year. And no surprise that disposable plastic contributes disproportionately to plastic waste because of the fact that it's made to be thrown away, made to produce waste. And here's a key fact that I think a lot of people are simply not aware of, the fact that less than 10% of plastic is recycled. You know, you see all these ads on TV, you see the plastic bins everywhere. I know on our campus at Boston College, where I teach, the students, the faculty are very conscientious about putting their used plastic into the proper bin. It's not the problem of the individual consumer. The problem is with the plastics themselves. There are many different types of plastic. Polystyrene can't be commingled with polyvinyl chloride. Polyvinyl chloride can't be commingled with much of anything because it's too toxic. All those different additives that are in chemicals, you can't mix one group of additives with another group of additives. You end up just with some kind of brown glop that can't be used for any kind of useful product. And the end result is that most plastic is either put in landfills or it's burned, or it's shipped overseas to developing countries, and less than 10% is truly recycled. So plastic recycling is way behind paper recycling, cardboard, glass, aluminum. And again, it's not because people don't care, it's because the plastic itself, because of its chemical composition, simply cannot be recycled. And the claim that, the plastic manufacturers are always saying, oh, we can recycle our way out of the problem. But they've been trying to do that for 40 years and they have made very little progress. So how about plastic's contribution to climate change? Well, first of all, here's a graph. You've probably seen versions of this in this seminar series, looking at total carbon dioxide releases going back to the 1600s. And you can see most of the fuel that's been burned and most of the CO2 that's been released has been released since 1950. So if you think back a couple of slides, this great increase in consumption of fossil fuels covers pretty much the same period of time as the increase in plastic manufacture. It took off in the immediate aftermath of World War II. And the dotted line is the dotted line is the increase in atmospheric CO2, and the solid curve and from fossil fuel and cement. Okay. So more than 50% of all CO2 emissions have been released since 1950. Plastic production generates 4 gigatons per year. That's about 2% of the total. And this is going to increase as plastic production goes up. So plastics today, since the 1950s, more than 8,300 megatons or 8.3 gigatons of plastic have been produced. This is 1 ton for every one of the 8 billion people on planet Earth. I've already said this, that short-lived plastics account for 40% of production. About 20 megatons are released annually to the environment. So why is plastic production increasing so incredibly rapidly? Why is it going so much faster than so many other indices? And the answer is that the fossil carbon industry is a vertically integrated industry. What that means is that the same companies that frack for oil, that frack for gas, that mine for coal, are the very same companies that produce fuel oils and produce plastic. Think Exxon, think Chevron, think Sinopec in China. These are vertically integrated industries that extract fossil carbon and turn it into products. And the economists in those companies can see that there is a trend away from fossil fuel combustion. People are not burning as much gasoline as they used to. They're not burning as much diesel. They're buying electric cars. They're putting solar panels on their roofs. Their cities and towns are building windmills. And the carbon industry can see that the market for fossil fuel is going down. But they're sitting on vast amounts of product because fracking and drilling have generated vast quantities of oil and gas. And so what they're doing is they're redirecting their product, they're redirecting their investment into petrochemicals and plastics. And it's being driven by the global transition to green energy. And it's basically, it's a pivot. And it's driving this almost exponential recent increase in petrochemical and plastic production. And at the center of this strategy are the single-use plastics, because plastics that people use just once and throw away and have to buy again tomorrow and have to buy again the next day are just a continuing source of cash flow for the industry, much more profitable than the plastics that go into medical equipment or the plastics that go into airplanes that last for years. Single-use plastics are basically cash money. Now, I mentioned that plastics contain lots of chemicals. Let's dive a little deeper into those chemicals. They include some very nasty actors. Chemicals like vinyl chloride, butadiene, PFAS, which can cause cancer. The chemicals listed here, brominated flame retardants, for example, that can cause brain damage in children, reduced IQ. And then endocrine disrupting chemicals like phthalates and bisphenol A. Phthalates can disrupt development of the reproductive organs, especially exposure during pregnancy can cause birth defects of the reproductive organs in baby boys, which leads to decreased fertility in adult life. And bisphenol A disrupts endocrine function by interfering with lipid metabolism in the liver, which leads to increased levels of serum lipids, which in turn increases risk for obesity, for diabetes, for heart disease, for stroke. And as I mentioned earlier, these chemicals do not stay in the plastic. They leach out of the plastic when the plastic is used. They get directly into people who are playing with plastic. They get into the environment when plastic is discarded, and then they cause toxicity. And here's a graph showing the increase in production of those of chemicals in general and those additive chemicals. And you can see that it pretty well tracks the production of plastics. There was this little dip in 2008 during the financial meltdown, but overall things have continued to grow year by year. So today there are an estimated 325,000 chemicals on the market, of which plastics chemicals are a subset. They're almost all made from coal, oil, and gas. They're new materials that didn't exist before 1950. They're used everywhere. They're very widely disseminated in the environment. The chemicals that, like PCBs, can be found in the high Arctic, Himalayan glaciers, the Marianas Trench deep in the Pacific Ocean, and they get into us. The CDC has a national health survey that they do on a continuing rolling basis. It's called the National Health and Nutrition Examination Survey, referred to as NHANES. And part of that NHANES is the National Biomonitoring Survey. And what CDC does in this National Biomonitoring Survey is that they take blood samples and urine samples from a statistical slice of the American population each year, and they analyze those samples for several hundred manufactured chemicals. And they typically find at least 200 manufactured chemicals in the blood, in the urine of every single American. The old, the young, pregnant women, newborn infants, doesn't matter. We all have these chemicals in us. To be sure, the levels are low and we're all still alive, but mostly we don't know what hazards these chemicals might have. I find it very worrisome to think that all these chemicals are in my body. I didn't put them there deliberately. I don't know what harm they're having. I don't know what diseases they're causing in me, but certainly they don't belong there. We also know that not everybody is equally exposed. We may all be exposed, but some people are more heavily exposed than others. And those people, not surprisingly, are the poor, they're minorities, they're indigenous populations, people who live near chemical factories, people who live along railroads and highways. And just like plastic production, chemical production is growing by 3 to 3.5% per year, which means it doubles every 25 or 30 years. And here's the real kicker. This is the thing that I find most worrisome, is that the great majority, that's like 80% or so, of the chemicals that are in use today, that are down there at Walmart or Target or Home Depot, 80% of those chemicals that you're going to encounter when you buy a product at one of those stores has never been tested for toxicity. Never. There's no information. We are flying blind. It's very different from pharmaceuticals. When you go into the drugstore and pick up a prescription drug, you can be sure that the chemicals that are in that prescription drug have been found to be safe. They've been found to be effective. The drug has gone through clinical trials. It's not a perfect system, but it's a very good system, and it protects the American public against toxic pharmaceuticals. A lot of countries in the world don't have that kind of protection, but we're very fortunate in the United States to have great protection when it comes to pharmaceuticals. But when it comes to commercial chemicals, consumer chemicals, industrial chemicals, as they're variously called, there's really nobody minding the store. And the great majority of these chemicals have never been tested for toxicity. Now we now know because of toxicologic studies and epidemiologic studies that many of the chemicals in plastics are linked to disease. Benzene and butadiene are linked to hematologic malignancies. Prenatal exposure to PCBs, polychlorinated biphenyls, causes IQ loss in kids. DDT is now linked to breast cancer. Let me tell you the story of how that was discovered. There had long been a suspicion that DDT might cause breast cancer because it's been known since approximately the 1990s or maybe the early 2000s that DDT could interfere with estrogen function. And it's thought that the reason that DDT almost caused the extinction of bald eagles was that it disrupted endocrine function in the eagles and caused the eagles to produce eggs that could not survive once they'd been laid. But for years and years, people struggled to find a link between DDT and disease in humans, and they weren't successful until finally, about 20 years ago, an epidemiologist at Kaiser Permanente over in California realized that in the tissue bank at Kaiser Permanente, they had hundreds of serum samples that had been collected from pregnant women back in the 1950s and 60s when DDT was still in wide use in this country. And so what she did was she linked the records. She measured DDT levels in those serum samples of these pregnant women. And then she tracked down their daughters, who by that time were 40, 50, 60 years old, and correlated the level of DDT in the pregnant mother with the risk of breast cancer in the adult daughter. And what she found was striking was that the heavier the prenatal exposure to DDT, the more likely the adult daughter was to have breast cancer. This is a powerful study when you can link individual exposure to individual disease outcomes in a multi-year study like that. Phthalates are a class of chemical very widely used in plastics to make them flexible. And I already mentioned that they're linked to male reproductive defects. They're also linked to IQ loss in children. Bisphenol A alters lipid profile, cardiovascular disease. Brominated flame retardants can cause brain damage following prenatal exposure, and the consequence is IQ loss in children. Organophosphate insecticides like malathion can cause IQ loss and behavioral disorders. PFAS chemicals cause a whole range of adverse health effects, immune dysfunction, alterations of the lipid profile, thyroid disease, certain cancers. And one of the things that we need to recognize that all of these links between the chemical and the disease was discovered only years, in some cases only decades, after the chemical had been on the market. And that reflects the fact that chemicals are simply not scrutinized before they come to market. There are very few constraints on the chemical manufacturing industry. They can make what they want. They can run it by EPA. EPA has only a short period of time to respond to a request. Most of the reviews by EPA are very superficial. And then the chemical comes to market, and we don't find out that there's a problem until people start getting sick and people start dying. So the situation is, it's a bit like an iceberg. There may be, at the top of the iceberg, there are 20 or 30 or 40 chemicals that have been really well studied, where we really understand the hazard, and in some cases, we're even doing something about it. But then there are thousands of more chemicals below the waterline where we just don't know what health impacts they have. And I, as a pediatrician, I find that very worrisome to think that the children whom I see are exposed on a daily basis to chemical materials of totally unknown hazard. Makes you ask yourself, okay, what other, we know that phthalates cause IQ loss. We know that brominated flame retardants cause IQ loss. What other chemicals are out there? What other damage is being done that we have not yet been smart enough to recognize? So this was the context in which we undertook the work of the Mindoro-Monaco Commission on Plastics and Human Health. We understood this background that I've just reviewed with you, and we decided to look at the hazards of plastics across all three phases of the plastic life cycle: in production, in use, and in disposal. So production includes fracking, drilling, coal mining. It includes transport. It includes the manufacture of plastic products. The use phase is what it is, people using plastic products that have been produced. And then finally, the disposal phase in yellow here includes landfilling, it includes burning, it includes shipment overseas to developing countries of plastic waste. And then finally, carbon has a carbon footprint, which I've already mentioned to you, responsible for about 4% of all greenhouse gas emissions. So let's take a quick look at some of the elements of the plastic life cycle. So probably some of you have driven past a fracking well or an oil well. You know that there are massive operations associated with a great deal of pollution. They cause air pollution, water pollution, noise and light pollution. The transport of plastic raw materials is inherently hazardous. We have thousands of miles of pipelines traversing the country carrying gas and oil, and every now and then one of them catches fire and explodes. And we also have thousands of miles of rail lines crossing the country. And back in 2022, you'll recall that in East Palestine, Ohio, a train consisting of tanker cars carrying vinyl chloride monomer, a plastic feedstock chemical train tipped over. There was this terrible fire. The little town in Ohio had to be evacuated, and all sorts of toxic fumes were thrown into the air. And then we have these enormous factories that are going up. This is a factory. This picture is a couple of years old. The factory has now been completed. This was a $6 billion plant in Beaver County, Pennsylvania, outside of Pittsburgh, that is being built for the express purpose of turning fracked gas from Appalachia, from West Virginia, into plastic. And a lot of that plastic is going to be single-use plastic. So basically, the gas gets piped from West Virginia up here to Pennsylvania. It gets turned into plastic raw materials, which gets turned into single-use plastic, which gets used for a day, which gets thrown away, and ends up in a landfill, either in this country or overseas, all the while consuming vast amounts of energy and causing pollution and causing disease. And then plastic manufacture, you have these chemically intensive factories like this with lots of pollution coming out of them. And then we have plastic use, where people like these children are exposed to plastic, and the chemicals in the plastic leach out of the building blocks that these little kids are playing with, and they get into the kids. There have been an enormous number of studies done now of the health impacts of the chemicals that people are exposed to. And we now know that these health effects affect both men and women. They affect both babies and the elderly, every stage of life. So at the earliest stages of life, the chemicals in plastics can cause miscarriage and premature birth. In kids, they cause IQ loss and other neurologic problems, reproductive problems. They affect thyroid function, risk of hypertension, risk of obesity, timing of puberty. And then in adults, lung cancer, hypertension, heart disease, obesity, again, fertility. really an enormous series of problems. And the reason plastics result in such a wide range of health effects has to do with the fact that there's just a huge variety of different chemicals in plastic, and so there's space for a large number of different toxic outcomes. So as a pediatrician, I always want to speak for a moment about the particular vulnerability of infants in the womb and young children during the early phase of development. And what we have learned through years of research now, going back to studies of lead 50 years ago, is that infants and children are much more vulnerable to any toxic chemical than adults. And even very low levels that would basically bounce off an adult, can cause damage to the very young. Oops, sorry. And depending on the chemical, there's a whole range of different effects: brain damage, birth defects, cancer, premature birth, everything that was shown in that previous slide. The brain damage can result in autism, ADHD, decreased intelligence, IQ loss. And we've learned that there are simply no safe exposure thresholds. People talk about windows of vulnerability in early life, brief periods of time, sometimes just 2 or 3 days in duration, where if the human fetus, the unborn child, is exposed to a toxic chemical during that window of vulnerability in early development, you can have a lifelong adverse effect. It could be a missing limb. It could be a defect of the reproductive organs. It could be brain damage, depending on the chemical, depending on the timing. And the only rational way to keep these effects from happening is to prevent the exposure from taking place in the first instance. Okay, a word about microplastics and nanoplastics. Microplastic particles and nanoplastic particles are invisible particles that result when plastic breaks down in nature. So this little picture here, these are supposed to be microplastics, but really these are bigger than microplastics. The fact that you can see them means that they're not microplastics, but you get the point, that these are the small breakdown products of plastics. And studies done in the last 5 or 7 years have shown that microplastic particles are present in organs throughout the human body. They get into us through a couple of main routes: ingestion and inhalation. So they get into us by ingestion when we eat, for example, seafood or meat, where there are microplastic particles in the food chain that gets into the fish or into the cattle that we eat. They get into food when food is wrapped in plastic in the supermarket, and chemicals and microplastic particles migrate out of the plastic wrapping into the food. Plastics get into food if you microwave food in plastic. When you put a plastic dish containing food in the microwave and heat it up, the microwave energy drives microplastic particles, and it drives chemicals out of the plastic into the food. And so that's one piece of advice that I commonly give to patients, is to tell them never to microwave in plastics. Even if the package says microwavable, take the food out of the plastic, put it into a ceramic dish or a glass dish, and then stick it in the microwave, and you'll reduce your exposure to plastics. There was a big study published almost a year ago in March of 2024 in the New England Journal of Medicine, which was the first study to look at the health impacts of microplastics. And until that study was published last year, we knew that microplastics were getting into the human body. They have been detected in all these different organ systems, but it was unknown whether they were actually causing any health effects. And what happened here was that a group of cardiologists in Italy examined 312 patients who underwent a procedure called carotid endarterectomy. And what the carotid artery is, the big, every human being has 2 carotid arteries, one on either side of the neck. these are the big blood vessels that carry blood from the heart up to the brain. So here's the heart, here's the aorta, and here you have the left, I guess, the right and the left carotid artery, one going up the opposite sides of the neck. And in people that have arteriosclerotic disease, they build up arteriosclerotic plaque, this material here, which consists of cholesterol and calcium and other materials, collects and accumulates on the lining of the carotid artery, and it can cause a stroke. And so a carotid endarterectomy is a procedure whereby the cardiologist runs a catheter up into the carotid artery, and like a roto-rooter, they go around and they suck out this material to open up the artery in the attempt to prevent stroke. And what they found in this Italian study was that micro and nanoplastic particles were present in 58% of the 312 patients whom they examined. 40% had no particles, 60% had particles. And then when they followed these patients over the next 3 years, they found that the people who had the particles had a 4.5-fold increase in risk for myocardial infarction, for stroke, or for death. And of course, this is only one study. And because it's only one study, it certainly does not prove causation. But it's a striking finding. It's very worrisome. It needs urgently, other studies need urgently to be done to either confirm or refute these findings. But this is very scary stuff, to think that microplastic particles may be causing a 450% increase in risk for serious cardiovascular disease. This is not a study that can be ignored. Our Minderu-Monaco Commission decided that it would be important to calculate the economic costs of the damages caused by plastics. We did this because we figured that policymakers need to know the cost of things. It's important, of course, to tell them how many people die from plastics and what they die of. But policymakers have to make decisions. They have to balance budgets. They have to weigh the cost of environmental regulation against the cost of the defense budget. They have to weigh the cost of health legislation against the cost of Social Security. So if you can give them data on the cost of things, you can help them to make those decisions. So we looked first of all at the cost of plastic production, including the cost of injuries, air pollution, CO2 emissions. And we found that for the year 2015, that was the year we looked at, in that year, the cost of plastic production was $592 billion globally. And then we looked additionally at the costs of the diseases caused by plastic chemicals, by phthalates, by brominated flame retardants, by bisphenol A. And we looked at just one country, which was the United States. And we found that in just one country, the cost of these diseases was $675 billion. So putting it all together, it's about 1.2 or 1.3 trillion dollars per year is the total cost of the diseases caused by plastic. Massive sum of money. And of course, those costs are not borne by the plastic industry. Instead, they're offloaded by the industry, they're externalized, and they're forced onto governments and taxpayers and individual citizens. So basically, it's all of us through our tax dollars end up paying for these damages that are caused by the plastics industry. And I won't go into the slide in a lot of detail, but the point of the slide is to say that at every stage of the plastic life cycle, in production, in use, and in disposal, there are all sorts of social injustices. It's always the poor, the marginalized, the minority, the indigenous who get the short end of the stick and suffer disproportionately from the manufacture and use of plastics. And here's a few pictures of environmental injustice. So here's another picture of East Palestine, Ohio. basically a blue-collar working class town in Southeast Ohio. And over here are a couple of pictures of showing the massive accumulation of plastic waste that occurs in third world countries. These two photos are both from Nigeria. And the reason there's so much plastic in the third world is that a lot of our waste plastic from the USA and Europe gets put on ships and carried to poor countries where people sort it out and try to and either use it as fuel, they burn it in fireplaces to cook their supper, or they try to recover the stuff that can be recovered and make a few dollars a day to keep body and soul together in some very tough circumstances. Another example of environmental injustice is that a lot of the most polluting plastic factories, like these structures here, are located in historically Black communities, like these communities in southern Louisiana down along the Mississippi River. So to summarize, the main findings of our Mindru-Monaco Commission on Plastics and Human Health were that 6 billion tons of plastic waste pollute the planet. Plastic production is increasing exponentially. Plastic causes disease, disability, and death at every stage of its life cycle, and it's closely linked to climate change. The annual costs are massive, $1.2 trillion, and they fall disproportionately on the poor. So the global community has now woken up to plastic. It took a long time. It took a lot longer to recognize the hazard of plastic than it did to recognize the hazards of climate change. I think because a lot of the hazards of plastic are kind of invisible, but I think the world has now become keenly aware of these hazards. And so in 2022, the UN Environment Assembly adopted a resolution to develop a global plastics treaty. And that treaty is still in negotiation. It's not yet finalized. It's been a difficult negotiation because some of the countries of the world, like Russia and Saudi Arabia, that produce a lot of gas and oil, have been resistant to any kind of a meaningful treaty. They don't want any kind of an agreement that's going to reduce their production of gas or oil or cut into their profits. And so it's been a real struggle, but hopefully over the next year or so, the negotiators will get it right. Fingers crossed on that. Our Mindru-Monaco Commission made these recommendations to guide the treaty. We said that the treaty needs to recognize that human health is center stage when it comes to plastics, and that the treaty therefore needs to prioritize the protection of human health. And we said that the way to do that, the single most effective way to protect human health against plastics is to impose a global cap on the production of new plastic. Now, of course, as soon as you say that, as soon as you talk about restricting plastic production, people throw up their hands and they say, what are you going to do in medicine? How are you going to give intravenous? How are you going to do endoscopy? How are you going to put a laryngoscope into people? All of those materials require plastics. How can you build airplanes or cars without plastics? And we say, yes, we agree with that. And we say, listen, we're not talking about banning all plastic. We recognize that plastic is incredibly important in modern societies. But what we are saying is that, listen, we're intelligent beings. We can distinguish between the plastics that we really need, like medical supplies, like airplanes, and the plastics that we really don't need, like plastic shopping bags, or plastic food wrapping, or plastic water bottles. There are perfectly good alternatives to every one of them. And our proposed solution is you impose a cap on plastic production. You focus on weeding out the types of plastic that are not necessary for modern societies, and then allow countries to continue to produce the plastics that are essential. And the second big recommendation after a global cap is to have some oversight, some regulatory oversight and control of the thousands of different chemicals that are in plastics. So the good news, we think that if we want to do it, we can fix the plastics crisis. After all, it's a crisis that's come along in the span of about 75 years. It's totally man-made. There's no external factor driving it. It's all driven by decisions made by people in corporate boardrooms. We know how to control other forms of pollution. We know how to control air pollution. We know how to control water pollution. And we have shown, good studies have shown that controlling air pollution, water pollution is highly cost effective because it prevents disease and saves lots of dollars. And that experience provides a roadmap. And so I will contend that the impediments to controlling the plastics crisis, they're not technical, they're not scientific, they're legal, they're economic, they're political. And that's where the solution is going to have to come from the legal, economic, and political sectors. And I would argue that it's our generation's moral and ethical duty to do something about the plastics crisis and protect our kids and preserve this small blue planet on which we live. And to close in the last 2 minutes here, here's an example of how we addressed another big environmental problem a couple of generations ago. So back in the 1970s, we used to use about 100,000 tons of lead in gasoline each year in the United States. Lead in the form of a chemical called tetraethyl lead was added to gasoline to improve engine performance. And in the 1970s, it became recognized that lead was causing brain damage in kids at relatively low levels of exposure that were previously considered safe. And so EPA made the decision starting in 1975 to get lead out of gasoline. And they phased it out over some years. And you can see that over the next 5 years, lead came down from 100 to less than 40, and it's continued to come down since that time. Today, it's completely gone. And it was predicted that children's blood lead levels would come down just a bit. Here was the prediction. But in fact, the blood lead levels, which are represented on this axis, came down from around 17 micrograms as a national average in 1975 to around 10 by 1980, and then came down and came down again. And today, the average blood level in American children is about 1.5 micrograms. It's really an amazing reduction. So here are the consequence has been that every American child born since 1980 is smarter because they're not burdened by lead. They have higher intelligence, and that increase in intelligence has pumped billions of dollars back into the American economy. And then here's another example. This is what we've accomplished through controlling air pollution under the Clean Air Act. So the Clean Air Act was signed by President Nixon in 1970. Since that time, air pollution levels in the USA have come down. The total reduction in air pollution is about 77% since 1970. And in that same time, the gross domestic product, this green line, has gone up. So that the GDP has grown by 250% at the same time as the air pollution fell by more than 70%. So anybody who tells you that regulating pollution is going to cost money is making up their facts, and the data do not support that claim. I know that you hear that claim all the time in political circles. If you control pollution, you're going to kill the economy, you're going to cost jobs, you're going to force the industry to go to Mexico. That it doesn't work out that way in reality. In fact, it makes people healthier, it makes them smarter, they live longer, and they're economically more productive, and the economy thrives. And every dollar invested in air pollution since 1970 has yielded a return of $30. Very few stocks give you that kind of a return. So in conclusion, the time has come when we have to act. There's a lot about plastics and chemicals and their hazards that we don't know. And of course, more research is needed. I'll be the first to agree to that. But we know very clearly that plastics are harming health, harming the environment. And we know that if we don't act urgently, these harms are going to get worse. And we cannot use the lack of knowledge as an excuse for sitting on our hands and doing nothing. So with that, I'll close it down. I'll stop sharing my screen and I'll give it back to you, Evan. And thank you very much for the chance to make this presentation.
Well, thank you so much, Dr. Landrigan. That was a real tour de force that I think has opened a lot of eyes. The findings about costs, both financial and in terms of human health harms, are just shocking. Are you or others able to access the decision makers to ensure that they're aware of these costs? And who is representing us in front of governmental organizations, regulatory bodies, or others in deciding whether we continue to use plastics?
Yeah, well, yes, my colleagues and I have done our best to bring these findings to the attention of regulators. And we've done it at the federal level. We also recognize that there's the chance to change policy at the state level. So we've been active in state capitals across the country. I was pleased when you made your announcements at the beginning of the hour, you mentioned that my friend Laurie Byron is going to be talking to this group in your next session. And Laurie has been incredibly active working at the state level over next door to you in Montana. And that's a model for what can happen at the state level.
Following up on that sort of topic, the EU's European Chemical Agency has a lot of information on chemicals. Is the US coordinating with EU data, or is the EU's role influencing the practices in the US at all?
No, I mean, there's certainly communication between the American and the European regulators, but I think it's fair to say that the Europeans are doing a better job of protecting their citizens against chemicals than we are in this country. Neither one is great, but the European system is stronger than ours.
And kind of, I'm just taking a number of questions from the audience and trying to collate them into one stream of thought here. Kind of next step down, what are key leverage points that individuals and groups can use to curtail plastic production and use? Do you see ways that we as individuals or we as an organization can really be most effective at getting plastics out of our lives?
Yeah, well, that's a great question, and it's important to think about what we can do, because even in times when maybe not a lot of action is coming out of the national government, there's plenty of stuff that we can do to make a difference for the good. So firstly, every parent can act within their own home. I mean, parents are the CEOs of their own home. They control what they purchase, what they bring into the home, what they do in the home. So I say, avoid plastic toys if you can. Buy wooden toys for your kids, unpainted wooden toys, so there's no lead paint. Don't microwave in plastic. If you can avoid buying food that's wrapped in plastic, which I know is not easy, but if you can buy food that's not wrapped in plastic, go for that kind of food to minimize your family's exposure. And then at the local level, in the town, the city, the state where you live, people can push for bans on plastic bags. There's a lot of cities and towns across the United States now that have banned plastic shopping bags. You can push back against the companies that are going to try to sell a plastic synthetic turf field to your local high school, because that turf field is made up of toxic plastic and ground up truck tires. It's not stuff that kids should be playing on. Natural grass is so much better. But of course, the marketing is very intense, trying to persuade high schools and local school boards to buy those artificial turf fields. And then finally, take the time to meet your legislators, your state legislators, your federal legislators, talk to them in their home offices in the state of Idaho, rather than making the pilgrimage all the way to Washington, and say, this isn't a political issue. We're talking about trying to protect kids' health. Why don't we see if we can get together, set aside political differences, do the right thing to protect children?
Yeah, and that's really been our strategy in dealing with things here, is that this is not something where this is my political opinion. This is a healthcare issue, and that's sort of the overarching focus of this learning series, is just to show people how our health is being impacted by climate. So I think you've hit it out of the park today with your talk. We're just about out of time, but if you've got a few minutes to stick around, we can continue asking questions if you're okay, giving us a few more minutes.
I could another 5 or 7 minutes. I could stick around. Well,
okay,
one thing I'd like to say about making a difference is, I'm sure that there are a number of physicians, nurses, and other healthcare providers among your audience. We who wear the white coat should never underestimate how important we are as credible, trusted spokespersons. And when we physicians and nurses and healthcare aides and public health workers tell people to be worried about plastics, to be worried about chemicals. It makes a difference. You know, for years and years, doctors have been talking to patients about don't smoke, eat a healthy diet, get plenty of exercise. Let's add to that list some common sense advice about reducing your carbon footprint, reducing your plastic and your chemical footprint.
Yeah, and you know, to that point, I'd like to encourage everyone to come check out the Idaho Clinicians for Climate and Health. Our website is just idahocliniciansforclimateandhealth.org. We are having a winter social next Wednesday at Lost Grove Brewing. We're going to have sort of a meet and greet with some of our leadership, and we will be showing some films from Protect Our Winters about how climate change is impacting our love of the outdoors. So that's next Wednesday at 6 p.m. at Lost Grove near Boise State's campus. Let me just dive back into one or two more questions, Dr. Landrigan, if you've got some time. We'll try not to take too much more of your time. For all their ills, plastics are a really handy material. Are there realistic non-fossil based alternatives that exist? And if not, are there examples of these on the horizon? And kind of a follow-up on that, are bioplastics really any better than fossil plastics?
Yeah, I know that there are some very bright people working on bioplastics and alternatives. I don't consider myself expert on that, so I don't want to go too deep into it. But I will repeat what I said before, that there are certain plastics, even fossil fuel-based plastics, that I think are essential. And I don't want people to leave this seminar thinking that I'm advocating for getting rid of all plastics. I'm not. But I'm saying we can use our intelligence to distinguish the necessary plastics from what I have called the stupid plastics, and we can get rid of the stupid plastics in our lives.
Much of the single-use plastics that we're using is in packaging of foods. How do you envision the food system changing to one that doesn't use plastic so much?
Well, just think back about 10 years. There was way less plastic in food. This is something that has crept in so that now it seems essential, and yet it's not. It's just, and you know, and 10 years, 15 years ago, you went to the supermarket, everything was not wrapped in plastic the way it is now. People got a paper bag and put their apples, their potatoes, their broccoli in a paper bag. You can recycle paper. You can't recycle plastic bags.
But some of the plastics that we are using aren't necessarily overt. I'm thinking of like the plastic linings to some of the things we think are non-plastic, like tin cans. Are we able to eliminate those covert plastics from our lives? Is that something that we'd have to do with regulation?
I think some of that's going to have to be done through regulation. Yeah, because individual consumers just can't know that. You can't put that burden on people. They've got busy lives. They've got a lot to do.
The slide you referenced at the beginning, talking about kind of the dawn of plastics, I feel like is being echoed in medicine today. And I had a conversation earlier today about how this same sort of conversation of why I risk contamination or why deal with the hassle of cleaning when you can just throw that cystoscope away. How do you think we can combat this trend towards disposables in healthcare?
Yeah, well, healthcare generates a huge amount of disposables, and you know, it wasn't so very long ago that instruments were sterilized. Hospitals had a central supply department with big autoclaves, and they sterilized equipment, and stuff was reused endlessly because the instruments are expensive. And it's obviously going to take some money, some leadership, some imagination to go back to that. But I think it's feasible. And right now, hospitals have to understand that when they throw stuff away, that is not a neutral act. That material that they're throwing away is causing harm to the community where the hospital is located and to more distant communities where the waste ends up. And if hospitals and health systems really want to be true to the core mission of defending human health, they need to rethink their use of plastics. The other thing that healthcare systems can look at is what about the dining services, plastic plates, knives, forks, and spoons? What about those plastic sheets on the bed? It wasn't so long ago that the sheets on the bed on the examination table were paper or cloth. Why can't we go back to that?
Yeah, it's interesting. One of our colleagues at the VA here just did a project to introduce reusable gowns as opposed to the single-use plastic disposable isolation gowns that we've been using.
Yeah.
And they found that those gowns have PFAS and PFOA in them, the reusable ones. So even the reusable cloth gowns are embedded with plastics that made it less appealing, and it was part of their, their ability to have certain properties. But it's like,
Yeah,
why
no,
can't we
no,
just have
that would make
cloth
them,
gown?
that would make them waterproof. Like if some blood or body fluids got on the gown, it would shed like Gore-Tex. But
Mhm.
you can specify pure cotton. It's all about supply chain.
Well, I'll just ask one more question and then we'll wrap things up. And I really appreciate your time. Um, do we know, or are we too early in this process, if plastic microparticles or nanoparticles, once they're in our body, is that something permanent, or do we shed these from our body as well?
I don't know. The early days on that research, I just don't know the answer.
Okay. Well, I truly appreciate your time, Dr. Landrigan. Thank you so much for all that you've done. What an amazing career you've had, and I appreciate you continuing to lead to try to make our world a safer place for our kids. And again, I hope everyone will join us on February 19th with Dr. Lori Byron. And then again, next Wednesday, let's see, that's the 15th at 6 p.m. at Lost Grove for an Idaho Clinicians for Climate and Health Social. So thank you so much, Dr. Landrigan. I hope everyone has a great day.
You're very welcome, and sorry I can't join you for that social next week. All right.
Yeah.
Take care.
Thank you.